Hi guys, today we have a cool case. It's actually my mom, and we're going to be treating her with Restylane Defyne for her temporal volume loss and lateral brow volume loss and upper eyelid volume loss. We're going to be treating her with Dysport for upper face lines, also to open up her eyes and relax some of those crow's feet. And then I'm going to use a little bit of Restylane Refyne to soften up her nasolabial folds as well. If you look here, the goal of treatment is, if you see the little give in the tissues, I'm going to treat some of this volume loss here and in the temples. I'm also going to try to raise the brow, and then I'm going to open up her eyes with the Dysport around the eyes, relaxing this orbicularis muscle. And we're going to treat the nasolabial folds with Restylane Refyne. So I'm using a hyper-dilute solution of Restylane Defyne. I've pre-blended the Restylane Defyne with 1 cc of bacteriostatic or preserved saline and 1 cc of 1% lidocaine with the 1 cc of Restylane Defyne. So we have a 3 cc solution. So one thing that I always prepare my patients for when using this technique, I used Restylane Defyne pre-mixed or blended with lidocaine and bacteriostatic saline or preserved saline. Because of the lidocaine in there, it is going to be difficult for the patient to raise their brows for the first 45 minutes to an hour, and you can see that in this patient, my mom. Raise your eyebrows. You can see she can raise this brow but not this brow, and that's because of the lidocaine in the filler, and that will resolve on its own over the first 45 minutes to an hour. Although I mentioned that here because if you don't know that this is something that happens, you may think something went wrong. So that's a complete treatment. What we did today, to summarize, was I injected Dysport into between the eyebrows, on the forehead, a very low dose because I didn't want to make her forehead appear heavy. I injected Dysport around the eyes to open up her eyes. I treated her temples with Restylane Defyne, hyper-dilute Restylane Defyne. I injected her lateral brow, the upper lid, as well as the temples with the Restylane Defyne. I treated her nasolabial folds with Restylane Refyne. I also put a tiny bit of Restylane Refyne at the corners of the mouth. And then I treated the lateral canthal lines, the crow's feet, with Dysport, the nasalis, the bunny lines, with Dysport, the chin, the mentalis, with Dysport, as well as the masseters, a very tiny dose of Dysport, because I didn't want to reduce the muscle bulk so much that she started noticing jowls, which is important when you're doing the masseter treatment with Dysport or Botox in a person over 40 years old of age. So very nice result. Of course, the Dysport won't kick in for about 72 hours, can take up to 14 days to see the full effect. In 2 weeks, she's gonna have an awesome result.